Thank you, Stephen, for coming to support our meeting about Lyme disease. Shortly ago, I talked to Karsten that I'm very happy to have you all here, because I think that all of us are aware of the situation that this issue is rising. More and more patients, due to climate changes, have Lyme disease. The statistics, as I mentioned today, is much higher than, for example, encephalitis. I am glad also when we discussed during presentation our experience, because when you said your comment about vaccination and aggravation of symptoms of Lyme disease patient, I have the same experience. So I was happy to see that you see patients every day, on everyday basis, and that's why we organized this meeting, because if I read textbook, there is written that Lyme disease is easy to treat for 3 weeks. Then you are sitting in your office meeting patients every day, and they don't behave like in textbooks.
Right. I have a slide in my presentation that says you can see it in the office and never see it in a book.
Exactly.
You can see it in the book and never see it in the office.
Exactly. And when I met Karsten last time, we had the same experience, that I also could see from his experience that it's like what you say, he has experience that it's not in textbooks what he sees in patients. So you come from, as far as I understood, you have 2 offices in the United States, so one is in California?
No, I have my main office is in Rhinebeck, New York.
Mm-hmm.
And for the past probably 25 years, I've gone up to Albany, which is an hour away, once a week. And then I started going about 5 years ago to LA because my daughter was in school there. So, and then I established a part-time practice. You know, it's every 6 weeks to 8 weeks. But actually, it's afforded me time to work with Dr. Rabar, who's here today.
Yes, yes.
And he's a great GI guy.
Yes. So you see more patients diagnosed with Lyme disease comparing to what you saw 15 years ago?
Well, I first started out in family practice and then quickly got into integrative medicine about 40 years ago. And got into Lyme about 35 years ago. And the increase in Lyme disease has been exponential. It's just amazing. In fact, my practice, I see a lot of chronic Lyme disease, but actually the last 2 years, I'm actually seeing more EM rashes because people know me, and then they go to urgent care, and they get 2 pills of doxycycline, and they know it's wrong. And so then they search out someone like, is this the right treatment?
So when you treat your patients, you give them antibiotics for a longer time, that what is common?
Well, it depends on the patient. I mean, I use obviously groups of antibiotics for the Lyme and the co-infections. I use IV rosifin, but also for the past 4 years I've been using ultraviolet light treatment of the blood. And then for the past 3 years adding ozone. And just when to do what in patients depends on the patients and their response.
So you mentioned that what you see in your office is not in textbooks. So you have to individualize your approach, and once you treat somebody for a longer time with antibiotics, or you use something what is not in textbooks like ultraviolet treatment, do you have problems with authorities? Is there any problem?
No, I was, when I did the UV, it was under an IRB, so that was good. And the ozone is pretty well accepted, although most conventional doctors will look at it and say, what are you doing? But it's quite substantiated in the European literature, more so than the US.
Yes, because what I can read in the literature sometimes when American patients complain that the Lyme disease is not recognized in the United States or in Canada. So I thought that you have the same difficulties like we have here in Czech Republic or in Europe, that a lot of patients are blamed to have psychosomatic problems, not the real health problems. So if it's evidence-based medicine, you have no difficulties in the United States. That's what I understand.
Well, what I do with my patients is basically listen.
Yes.
And so when I first see a patient,
Yes.
it's about an hour and a half, 2 hours, and they go through their history, and it's psychiatric, and it's GI, and it's musculoskeletal.
Yes.
And invariably what the patient does at the end of it is cry and just, they're overwhelmed that someone is listening.
Yes.
And what happens in regular medicine is they listen for 5 minutes and they say, this patient is crazy.
Yes.
I don't get it, so they must be crazy.
Yes. No, I have the same experience. That of course that makes me tired, exhausted at the end of the day, because you have to really try to. That's I think that comes from probably the same feelings that you have as well, and I have as well, because I really would like to understand what kind of health problems the patient has, and I am interested in what the patient has as the diagnosis and how shall I help the patient. So I agree, it's more difficult. When you treat the patients and diagnose the patients, they have it covered by insurance?
No, I have been out of insurance for over 30 years.
Yes.
And I find that it's very difficult in insurance. Like if I want to order tests on someone, the patient says to me, well, what tests are covered?
Yes.
And I say to them, better you should ask which tests are the good ones rather than what's covered.
Yes. No, I agree, because it's an issue here in Czech Republic and also for Karsten in Germany, that this non-textbook approach, it's difficult to be recognized by insurance companies, so patients have to mostly pay for it as well.
Well, patients know that my office doesn't accept it, and the way I tell them is that I can't work under the insurance guidelines because you're in like a box. And I often tell patients when I lecture that there's patient-oriented medicine and there's financially oriented medicine. And I'm taking care of you, and it's going to be oriented towards you, not towards finances.
Exactly. One more question. We have problems with ticks in Czech Republic that are known from textbooks to have the Lyme disease and to transfer it to human beings.
Now what, I missed that?
Ticks, they transfer Lyme disease. But my experience from everyday office is that very often patients are bitten by something else. So it's very likely, although it's sometimes difficult to prove, that other bloodsuckers transfer the infection. So you have the same experience in the United States.
I see that all the time. They say, well, I was bit, but it wasn't a tick, but it was a bite. So, and that's usually the inciting agent. So you have to kind of then hear what happened afterwards. And just because it's not a tick bite, you can't say, no tick bite, no Lyme. It doesn't work like that.
Exactly. That's why we have all these beautiful pictures here. I just I
took pictures of all that.
Wonderful, because I want to open the subject that we have to be able to communicate on this level, to say, because we can catch lice, we can catch mosquito, we can check what they have in the belly, and if they have Lyme infection or encephalitis or other infections, it's likely that it might be transferred to human beings. So it's necessary to open this kind of discussion.
I think that's totally...
To give doctors who wants to know and understand what is going on with the patients, and also what happens in Czech Republic, that patients are sent out of doctor's office if they say, I did not have tick. The doctors say, you cannot have Lyme disease without any diagnostic tests. So that's why I want to mention that it's not necessary, it has to be only tick. Thank you very much. Thank you.
Pleasure being here.
Thank you very much. Thank you.